We're going to begin now with, this is the environment section, with Dr. Nglandu Ngatu. I'm sure I didn't say it quite right. He is the Associate Professor at the International University of Health and Welfare School of Medicine in Japan. He serves on the Academic Society International Committee on Occupational Health. He is published in the African Annals of Medicine and is the Associate Editor of the Annals of Phytomedicine. And he is an editorial board member of the Journal of International University of Health and Welfare. So Dr. Ngatu is going to speak about effects of ambient air pollution on human respiratory health.
Good afternoon, everyone. 여러분, 안녕하십니까? 미나사마 konnichiwa. It's quite unusual to introduce myself in foreign languages, okay? So in Congo, we speak French, so I'm a native French speaker. But I've been living in Japan for already 18 years, and I cannot use French in Japan. Japanese do not speak French, so I try to use Japanese language because my family is an international family, and we speak only Japanese in our family. But because of work, because of communication, sometimes I have to use English. So I would like to apologize if you cannot understand my message that I will give in English. I'm a researcher, a unificationist researcher. So I'm very grateful to the organizer of ICOH 2020, and especially to Father and Mother Moon, the two parents, because what I am today could not be if I didn't meet Father and Mother Moon. I was a high school student in 1985. I was born in a very poor family. I was studying in a rural area, very far from the village where my family was living. Sometimes I didn't have food. I had to teach science, math, physics to my classmates and share their lunch or their dinner at their home. But in 1985, I had a very surprising spiritual experiences. God sent someone who came to pick me and bring me to heaven. And that person was an Asian lady. So I could visit God's kingdom in that experience. And the message that that servant of God gave me was you need to go back to the Word, serve God, and then you will be qualified to come here into the kingdom. 3 years later, I was already a medical student at the Kinshasa University in Congo. I met someone who already knew Father Moon. I didn't know anything about Father Moon, about the principle, and he introduced me to the unification family. At that time, I could realize that the person, the servant of God, who picked me to heaven in 1985 was Mother Moon. Okay, I will introduce today's presentation entitled Effect of Ambient Air Pollution on Humans' Respiratory Health. I'm a specialist in environmental health and global health, so I will be talking about my short experience in this field. I don't know, can you hear me well? Is my English not so bad? So these are the main point of my presentation: the background, air pollution and disease burden, and some solutions to ambient air pollution associated respiratory diseases. I have no conflict of interest regarding this presentation. I will use some materials from WHO, and I got the permission from WHO media centers to use them in this presentation. So, ambient air pollution is a major environmental health risk. There are many diseases occurring in different countries, different parts of the world, that are caused by air pollution. It is #1 environmental risk to human health and one of the big killers of this time. It affects all people. It's a silent killer. We don't see the dust sometimes, but that dust can kill us. It is killing more people in the world than HIV/AIDS, malaria, and tuberculosis. These figures shows the epidemiologic profile of deaths caused by air pollution. The main organs affected by air pollution in humans are the lung, the heart, the brain. According to a report from WHO, in Southeast Asian region, every year, almost 2 million people die due to air pollution. In Western Pacific, over 2 million. In Africa, about 1 million. In Europe, 500,000. And air pollution causes about 4,200,000 premature deaths annually. Here we have the situation of pollution in East and Southeast Asia. The most affected countries are China and India, and Japan and Korea. Mainly they are affected by pollution coming from China or Mongolia with the Asian dust storm. 92% of Asian Pacific population, almost 4 billion people, are exposed to high levels of air pollution with significant risk to health. In India, 1 in 8 persons die from diseases caused by ambient air pollution, according to expert reports published in Lancet in 2017. So that picture shows how the city of Mumbai sometimes is really polluted. Recent studies conducted by Korean and Japanese researchers showed that an increase in the levels of PM2.5, which is part of the pollutants of the air, has caused an increase in the prevalence of asthma and other diseases, especially skin allergy and skin inflammation. Another report from the World Bank shows that every year there are almost over 20 million cases of respiratory diseases occurring there, and of them, 300,000 people die due to air pollution. What is the situation in Africa, particularly the sub-Saharan Africa region? There are many people who are affected by pollution in Africa, mainly due to the change in lifestyle, as we are adopting in Africa the lifestyle of Europe, but also by the effect of ambient air pollution. Both factors increase the prevalence of non-communicable diseases, such as cardiovascular diseases and lung diseases. It also aggravates the pre-existing cardiovascular and lung diseases. So those who suffer already from heart diseases, vascular diseases, respiratory diseases will have their condition aggravated if they are exposed to air pollution, and it causes premature death. Because of change of lifestyle combined with air pollution, the life expectancy of Africans is reduced. The main contributors of ambient air pollution in Africa are the mining. The mining sector is the main activities that brings income to our governments. The construction sector and the transportation sector, because safety measures are almost not applied to reduce the risk. The quality of the air is an indicator of sustainable development goals, according to WHO. Air pollutants, they modify the climate and they threaten the lives and well-being of exposed population. All countries are affected. There's no country that is safe. As we know, the SDG 3 implies governments should ensure good health. When someone is sick, he can have free access to treatment in hospitals. But until now, that is not the case in many countries, particularly in Africa. And SDG 7, which implies a clean environment. We need to provide a clean environment, clean air to populations in all countries. So if we do our best to clean the air in our living environment, working environment, we can help countries to realize the SDG goals. So governments should prevent ambient air pollution and climate change to achieve these goals. What are the major pollutants of the air? So the first part of this slide shows the safe, normal ambient air, which is composed with carbon, helium, oxygen, hydrogen, argon, and nitrogen. But because of factors, natural factors, events that sometimes bring some pollutant in the air, and mainly human activities that produce pollution, so we have other particles that are not good for health within our living and working environment. The volatile organic compound, VOC, particulate matters, PM, sulfur dioxide, nitrogen dioxide, ozone, and carbon oxide. So those pollutants, if they get into our respiratory tract, will cause damages into our respiratory tract. How they act? So in this part, you see the particulate, the pollutant in the air. When they are inhaled, they will enter into the respiratory tract through the nose. Bigger particle will stay in the upper airway and cause irritation, inflammation, some diseases of the upper airway. But the very fine particles, ultrafine particles, will go into the deeper parts of the lungs and cause serious damages over there. SO2, which is highly soluble, will mainly damage the upper airway. And if it's in contact with the skin, you may have dermatitis, inflammation of the skin. For those who are allergic, they may develop easily skin allergy. NO2 and O3, ozone, they are less soluble. They can irritate the upper respiratory tract, bronchial and bronchiolar injury. Carbon monoxide is very toxic because it has a competition with oxygen. Our body, our organs need oxygen, and oxygen should be fixed on hemoglobin. But CO, high-level CO exposure, will bring too much concentration of CO, and CO will remove oxygen and bind to the hemoglobin and go into different parts of the body and cause serious injury. Other very dangerous particles, fine particles, are what we call PM10, PM2.5, PM01. They have very small size, and that allows them to move into the deepest parts of the lung. They will irritate the mucous membrane of the respiratory tract and even go into the alveoli, the place where the exchange of gas between CO2 and oxygen is realized. They will destroy the architecture of the cells, lung cells, and create fibrosis. So the capacity of humans to breathe will be reduced. This slide shows the relationship between exposure to the pollutant in the air and the response. So the upper part shows the relative risk of heart diseases, such as ischemic heart disease, if the level of PM2 points in the air increases. The lower part shows respiratory diseases like infection, lung cancer, and chronic obstructive pulmonary diseases, COPD. So the more PM2 point level increases, the more people will develop those diseases. Silicosis, one of the diseases of the lung caused by exposure to silica dust in the ambient air. You have a normal chest radiograph, and you have abnormal chest radiograph of a worker, a miner, who was exposed to silica dust in the working environment. So he developed what we call silicosis, pneumoconiosis, with some black, white dots, and those nodules, white nodules, can come together and make what we call a large opacity, which can lead to cancer. You have a lower part, the image of a cancer of the lung. This is a study we conducted, some studies conducted in Congo, in a mining site. We found that high levels of PM2.5 and VOC were found. at the working site compared to control site, office workers. And the lung function, the capacity of them to breathe was reduced. And in women who crushed the stone to survive, sell the stone to survive, the working place also was polluted, and their lung capacity also was reduced. For solution, there are different solutions. Maybe engineers will talk about cleaning the air, using air purifier, shifting to clean power engines, working, cycling. You have some solution for agriculture sector, but in the health sector, we need to train doctors specialized in environmental health, occupational health, to conduct air quality monitoring, to conduct a risk assessment among population, community members, and workers exposed to air pollutants. This picture shows activities in Japan, in rural areas, rural communities, doing risk assessments. Also in Africa, training doctors to be able to identify diseases caused by exposure to dust. We need to use personal protective equipment, PPE, such as masks, but we need to use good, appropriate masks. Not all masks can protect us. We need to regulate some activities, informal mining, where people are exposed to dust. In a nature, our mind and body are in relation. It should be harmonious. And the human, should be in harmonious relationship with the environment, which contains air, plants, and water. If we live in ignorance about our environment, we can destroy that environment. By destroying environment, we destroy ourselves. So we need a healthy mind, healthy body, and a healthy environment in order to live in peace. I will conclude with the short video from WHO for awareness about ambient air pollution. So we need to provide a clean environment with a clean air to our children in order to ensure their future. Thank you very much. Kamsahamnida. Arigatou gozaimasu.